Now, as we begin to recognize the importance of human rights implementation, we look to human rights advocacy in the domestic implementation of rights. And let me turn now to Joe Amon, who draws on his academic research and his human rights advocacy to examine the range of advocacy tools that have been used to advance human rights in global health. Joe? Mute.
Sorry, once again, thank you, Ben, and thank you, Larry, for your leadership on this volume, this important work. I think it's a great honor and pleasure to be here with all of these people who are really leading the development of this field. And with my co-author, Eric Friedman, it was a lot of fun working on this chapter on advocacy. And to be honest, 2020 has showed us that this is a year that has demanded human rights-based global health advocacy, not only for the COVID pandemic and the response to it and the failure to respond to it by many governments, but also because of the importance of responding to racism and other systems of oppression, to overturn the vast wealth inequities that exist in this world, and ensure that human rights are at the center of how we address public health challenges and ensure that people have the right to have the highest attainable standard of health. So this chapter, like many of the other chapters, references the foundational HIV movement, which was galvanized by activists and advocacy and demands that the right to HIV prevention and treatment are respected by governments, that governments can't simply choose that they don't wish to engage or respond to the HIV epidemic because of ideology or because of discrimination or other factors. But what I think is interesting is that it goes on in the chapter from that to look at vast numbers of other health issues. And in my work and in my experience, I've had public health people say to me often that we need more attention to human rights on issues like TB, like neglected tropical diseases or other issues. But sometimes when I ask them why they see that as important, they refer to one aspect of the HIV movement, and that is that human rights advocacy was able to galvanize more funding for the response. And that is the wrong message. Human rights advocacy demands that those who are affected be involved in every part of the response, that governments cannot take repressive approaches to not put in place evidence-based responses. It demands that there's dignity, that there's a right to information, to be free from discrimination, from violence, and from arbitrary detention. And the chapter outlines fundamental steps to conducting human rights advocacy. I worked as an advocate for a long time with Human Rights Watch, and these were the sort of steps that were distilled in our approach at Human Rights Watch: documenting abuses and raising awareness of an issue, putting an issue that's been neglected, that hasn't gotten attention from governments on the stage, whether that's palliative care and access to pain medicines in certain countries, whether that's aspects of sexual reproductive health and rights. The next big section is on building coalitions and engaging communities. Nothing goes forward without the support of communities, without the engagement, without people working together for change. And then the final step that we talk about is the process of reforming laws and policies and practices, enforcement, engaging government officials and other actors directly, quietly, loudly, in the streets, in boardrooms, in conference rooms, providing model laws, all strategic litigation. All of these different steps are part of the process of doing advocacy. Finally, the chapter talks about new partnerships and new approaches to advocacy and partnerships between NGOs and academic communities, recognizing the need for bringing in more diverse actors who haven't necessarily identified themselves as working in a human rights frame, and being intersectional between those communities to find the points of agreement and common understanding and direction. And then finally, we also talk about using digital health technologies to demand accountability, which is really the fundamental part of human rights advocacy. So I find this chapter a distillation of a lot of my work, and I find it within the context of the book to be incredibly helpful for the students that I have. And I hope that all of you listening will be able to find that same interesting ways to advance it and to motivate the next generation of activists and of scholars in this field. Thank you.
Thank you so much, Joe, for introducing the innovative strategies for advocacy that you've developed over the years to facilitate accountability for neglected public health issues.